How can movement help hypermobility-related pain? And honestly, this is a brilliant question because movement is medicine. And I can't emphasize that enough. Movement can offer us so much to help reduce and manage our hypermobility-related pain. So how does it do that? Well, first we need a safe and appropriate movement program. It has to be right for you at this time. So by starting slow and starting low and listening to your body, we can really start to work successfully on reducing our pain. The first step would be building body awareness. So we know that people with hypermobility often lack proprioceptive awareness of where they are in space. They have little awareness of their body and how to control their body. So one of the first steps to help reducing our pain would be to improve our body awareness, improve our proprioception. And there are many ways we can do that. So that's the first step, improving our body awareness. Now, once we've got some body awareness, what will happen is we'll actually start to have more control of our body, more control of our joints. So we'll become more aware maybe when we're locking our knees or locking our elbows. We'll just become more aware of those movements on a daily basis. And if we're doing that less, we're going to have less pain in our joints. So that's the second element. Then you've got the whole aspect of building muscular tone. So we know that we can become deconditioned quite quickly if we don't move. And when we become deconditioned, things become much harder and pain can increase. So when you start to move appropriately and safely, you'll start to build muscular tone and postural tone. So we'll be able to hold ourselves better. We'll be putting less strain on our joints. We'll start to reduce those tight muscles that are holding on, trying to stabilize, and we'll start to actually use our deep stabilizing muscles instead of our superficial muscles as stabilizers. And we'll stop using our joints as stabilizers, and we'll start to use the body efficiently and effectively. So we've got all these aspects that are going to help reduce our pain. But there's another aspect that we shouldn't overlook, and that's the emotional and psychological side of it. Because, living with a chronic illness, chronic condition can make us fearful of movement. We can be quite anxious and stressed about it, especially if we've had a lot of pain and maybe a lot of subluxations. We might have been reluctant to move. So one thing that's really interesting and exciting to do is to start working on the calming of the nervous system. Because if you've lived in a sort of an anxiety state, the nervous system can be quite sort of ramped up and quite, red alert. And what we want to try and do is reduce that so that it becomes less sensitive and more open and willing to experience movement. And there are ways we can do this through breath and relaxation techniques. So we're really looking at the physical side, but also the emotional and psychological side. And together, they can work really well in helping reduce our hypermobility-related pain. Okay, so there are lots and lots of reasons why we want to be moving every day, if possible. And it doesn't have to be a formal exercise class. It can just be being functional around your house or going for a walk. But remember, movement is medicine.